Hello, Mindshare. I always have the privilege of somehow being the last one to speak. So I'm going to ask you guys to help me out, be a little bit interactive because I need the energy, and I see some of you coming down a little bit. Today we are talking about something that I am very passionate about, but I want to ask you a couple questions first. How many of you would like to scale your business? Yes, come on, in the back. That's way too quiet over there. How many of you would eventually like to sell your business? Yes, ma'am. How many of you are still the primary revenue drivers in your business? We have a problem. The reason we have a problem is because whether you want to scale or whether you want to sell, the logistics of how you get there are the same. And your investors or your private equity buyers want to see that you have at least a 15 to 20% profit margin, and they want to make sure that you are not making most of it. They want to make sure that you have less than 30% of the revenue being driven by you. Here's why. Who wants to come in who is not the creator of a business and not by a business that's not profitable? They also want to make sure that when you exit, you don't take the business with them. Okay, great. Amazing. We have all wanted to work less in our businesses, right? Excuse me? We all want to work less in our business, so great. This is good news for all of us. But here's the thing, it can't just be a decision. Let's use this example. Let's assume that everything remains the same in your business, but you say, great, I just saw this amazing talk, and on Tuesday, I'm gonna stop seeing 50% of my patients. It's great, I have staff here, they can do this. Here's the problem with that. Remember, you want to keep that 15 to 20% profit margin. Well, now, all of a sudden, you have to pay somebody to actually see those clients for you, and I am not going to take, well, I just won't pay myself as a solution. So when you drop down to 50%, if you change nothing other than the fact that you are not seeing those patients, you've now dropped your profit margin from 18.8% to 3.4%. If you decided on Tuesday, heck, she gave me a good reason, I am done, I am out, your profit margin just dropped to negative 12.3. So there is a cost to your time freedom, and how do we do that? We optimize our businesses. The number one question I get from people is, how do you still have a business that you don't see a single patient in? Well, as you've heard, there's this little thing called AI. And without replacing us, with amplifying us, there is the potential for it to drive $15.7 trillion in business. And here's the thing, only 40% of companies are using it, and I guarantee you those 40% of companies are still using it like a Google search. They're not really applying strategy. So if you're in this room today, you have a narrow window of opportunity to be one of the businesses that actually applies this and gets ahead of the game. And I'm gonna give you a 5-point strategy to do exactly that. So the first thing is, I know it's boring, but we have to know our numbers. We have to know our numbers. Do you know that 90% of the businesses we work with don't know their break-even number? That means they don't know how much money they need to pay their team to cover their expenses. It's no surprise that 48% of small businesses go out of business in the first 5 years. But do you know these numbers? Because what we've seen is there is a huge differential between what people think they're doing and what they're actually doing. Most businesses have a profit margin, if they're a good business, of 10 to 15%, but really that needs to be 15 to 35. Our practitioners are sitting at a utilization rate of 70 to 80%. And that really needs to be 85 to 95%. Do you guys know how much more money your business would make in the difference of a practitioner being full from 70% to 95%? That's a 25% gain. And most of us are only using about 50 to 60% of our physical space to generate revenue. Why do we not know these numbers? Because traditionally they're really hard to gather. They're all over the map. And we don't get that opportunity to synthesize those into something that's meaningful that we can use to make data-driven decisions. Now, I'm not a tech girl. There are a lot of tools out here, but I want to present a couple to you today. It is by no means infinite. So for those of you who have a SaaS company, or for those of you who have a program and you're always struggling with pricing, something like ProfitWell is actually gonna help you do that. It's gonna pull all the information you need, the local demographics, and help you actually price that. Same with Tableau AI. That's gonna bring in a whole bunch of information and organize it for you in a meaningful way. If you've decided that you're one of those people who wants to sell your business, Live Plan is actually going to help you set goals based on what you would like to do and budget in reverse, right? Your accountant's not doing that for you. Your accountant's just telling you how much tax you have to pay at the end of the year. So we need to get savvy about those numbers because it's how we make smart decisions. And also, we just talked about your practitioners being 70 to 80%. How many of you in the room are practitioners? Amazing. How many of you are clinic owners? How many clinic owners wish your practitioners would stop being so lazy and just get to work and see more patients? How many of you practitioners wish your bosses would stop being so pushy and realize they're already overworking you? Right? It's not that these people aren't wanting to be at the capacity, we're just not celebrating their zone of genius. We're asking them to do things they don't know how to do, right? We didn't go to business school, we didn't go to finance school. What makes the assumption that they do? So if we want to support them, we want to give them tools that they can do that. So we need to give them tools that let them operate maximally in what really matters, client retention. Is Dr. Travis Bond in the room? He's downstairs. Okay. You need to go see him. There he is. This man is saving people hours and hours of work every day because he's taking all of that predictive data with bio insights and practitioners are spitting it out in what, 5 minutes, Travis? 5 minutes. Do you know how long it takes to research a patient? And, I would have poked out my left eye if I had to do one more chart when I stopped seeing patients. But that was before tools like Heidi and Freed. There is no reason for people to be bogged down by documentation anymore. So we're gonna give them the tools they need to make this easier. How many of you are doing stuff and know you have stuff on your plate that you probably shouldn't be doing? Okay, the CEO of a business needs to, on average, spend 80% of their time in dreaming mode, visionary mode, not answering email mode, okay? That's doing, that's not dreaming. That's not gonna build your business. Guess what? This is one of the most diverse AI areas that you can be using. Who wants an AI agent? Right? Super cool, very expensive. Very expensive to have a custom AI agent, especially if you're just starting to dabble in it. But Relay app can actually look at your workflow and do things that you do on repeat without you telling it. Imagine an incredible AI assistant who's gonna take that task that you have to say, do this, then do this, then do this, then do this, and just do it. Genius, right? We also have tools that can now triage for us, triage and put them with the best practitioners. Sully AI and Synthflow are doing those really well. And lastly, just like charting, I want you guys to stop answering your email. Yes, yes. Can we get a hell yes for stop answering email? There are so many tools for this, but they are so many great tools that are HIPAA and PIPA compliant, because I am Canadian and I do have to say them both, that can actually make sure they're answering billing question, practitioner questions well and properly. Okay, now we want to drive traffic. Lauren talked about this, Victoria and Jess just talked about this. Content creation has never been easier, and you need to do it as part of your strategy to get people in the door. Things like Jasper are gonna give you long content. Surfer SEO and WiseU are gonna make sure that it's appropriately SEO formatted, all the stuff, the bullets, all of that, so that AI can actually find it. And this really cool tool, UScan, is gonna make sure that you're using voice of customer so you can be answering those questions and those pain points versus telling people just what you do. And lastly, we need to clone yourself. Okay? So how many of you have trouble with hiring still? Right? We have tools like MoonHub, which get really specific on finding specialty areas. You should never, ever write another SOP in your life. If anybody does, come find me in the coaching zone. I will slap your hand, because we have so many tools for this now. And we can actually have tools that are training people in your unique methodology. So what is the impact of this? Well, number one, we're gonna eliminate decision fatigue because we're actually gonna have the data in front of us to make smart, educated choices. We are gonna optimize and reward our top performers so that they stop leaving us, so that we don't have to rebuild every time a practitioner goes elsewhere, but we're also gonna have better retention and better profit. We are going to decrease our time doing administrative tasks that are below your pay grade, and that is gonna lead to a system that automatically brings patients in the door. And most importantly, you are going to stop acting like a clinician in chaos and start acting like a CEO. Thanks so much, guys.